Hello and a very warm welcome to all of you on this special episode of World Heart Day. ICICI Lombard presents DIL Se, partnered by ET Now. Now, heart attack and stroke are words that are not unknown anymore. The number of people suffering from cardiovascular diseases has been rapidly increasing over the past few years, with an estimated 54.5 million in India alone suffering from it. Globally, 520 million people are living with cardiovascular diseases, and COVID-19 has further added to their woes, because many have been afraid to attend routine and emergency appointments because they are worried and they are scared that they would contract the virus. This has in turn also led people to become isolated from friends and families. Now, this healthcare crisis has made it urgent to find different and innovative ways to connect people to heart health, particularly among the lower resource population. And on this World Heart Day, September 29th, Times Network, along with ICICI Lombard, is trying to find out the causes that make one prone to cardiac ailments over the years, the role of health insurance in protection and rebuilding the hearts, and what we can do to protect ourselves and to save our hearts. We have two special experts joining us on this panel. Allow me to introduce them. We have Mr. Bhargav Dasgupta. He's the MD at ICICI Lombard General Insurance. And we also have Padma Bhushan and Padma Shri awardee, Dr. Ashok Seth, the chairman at Fortis Escorts Heart Institute. Gentlemen, thank you so much for joining me here today. Dr. Seth, I'd like to start with you. First up, so despite the increasing awareness around heart health, number of cardiovascular diseases, people suffering from cardiovascular diseases is increasing at an alarming rate globally as well as in India. How can one be more aware and vigilant for early signs and to prevent a serious situation?
You're so right, Sumit. India has become the heart attack capital of the world. To tell you frankly, deaths from heart disease in the West have decreased by 50% in the last 30 years. Deaths from heart disease in India have increased 300% in the last 30 years. 3 times the incidence of coronary artery disease. And as a race, we've got to understand that we're more prone to have heart disease. We are 3 times more prone than Europeans for the same risk factors, by the way. For similar risk factors, 3 times more prone than Europeans, 6 times more prone than Chinese, and 20 times more than Japanese to have heart disease. So we practically, as a race, we are loaded guns who could actually develop heart disease if the circumstances became unfavorable to each of us. And that's why both for men and women, heart disease has become the biggest killer. It used to be 10 years ago infections, but now it's the heart disease for both men and women. So yes, and that reason, one of the other big concerns I must point out is that over the last 15 years, heart disease in young individuals, which means people less than 50, has actually increased 200%. And that's the last 15 years. So these are worrying statistics, especially when we think that 50% of our population is youth. And if they're getting affected by heart disease at an early age, what's going to happen in 10 years, in 15 years, 20 years? And of course, we can discuss why this has happened, but we have to face the reality. And that's why this program, the messaging to people, how to prevent heart disease, how to control it, has become equally important.
Absolutely. And Dr. Seth, I will come back to you on those important points, because it's like almost like we're sitting on a ticking bomb in this sense. I will come back to you on that in a second. I just want to go over to Mr. Dasgupta. So, and in my intro, I said this, that it is that the pandemic has had an impact on everyone across the globe. But how has it impacted the health insurance industry specifically?
Well, Sumit, you're right. This is something that obviously has affected the whole world. And when you look at insurance model really works in a situation where a lot of people contribute small amounts to create an insurance pool, and a few people have an accident or a damage or a health event, and a large amount is paid out for each one of them. That's how the insurance model works. So when there's a pandemic, that becomes a real challenge for the industry. Now, if you look at what's happened for our industry, given the wave 1 and the wave 2 that we've just recently seen, the industry's taken a hit of already more than 30,000 crores. This was never expected or priced into our product. So that's been one immediate adverse impact that we've had as an industry. And by the way, as an industry, unlike most industries that have got affected, we've not gone back to anyone asking for a report, any support from the government or anyone else. So that's one negative. At the same time, in one way, it has increased the awareness of health insurance. And if you look at the research that people are doing about health care and health insurance, that's seen a significant jump. And if you see consequently, the demand for health insurance has increased very rapidly. If you look at the last 18 odd months, health insurance has grown at about 35% in terms of the premium collection. So while the first is a huge negative from a short-term perspective, the second is in the long term potentially a positive. The third thing that has happened that we are observing is that people are realizing the importance of buying proper cover. In the past, people would buy a 3 lakh cover or a 4 lakh cover, which people have realized that for a whole family, that's not enough. So we are seeing upgradation in terms of the sum insured that people are buying. And last, and I think this is probably the most important change that we are seeing, is the health-seeking behavior for customers are changing. And people are getting more comfortable with digital health, telehealth, virtual doctors, and seeking those services beyond just hospitalization when some big episode happens. So we are seeing multiple changes in the whole paradigm of health insurance, largely driven by this pandemic.
Dr. Seth, for an average adult, how much of exercise or physical activity is sufficient to keep cardiovascular disease at bay? Because sedentary lifestyle is said to be one of the major causes of heart attacks. Just your thoughts on that.
Exercise is one area which actually controls a lot of things within your body. For example, if I told you that 45 minutes of exercise with a 5-minute warm-up and a 5-minute cool down 5 times a week decreases our chances of heart attack by 20%. That's huge because it controls our weight. People who actually exercise, their blood pressure comes under control. If they have diabetes, that comes under control. It actually gives a sense of well-being. People who are wanting to be fit, give up smoking. They actually want to exercise better. And it gives a sense of positivity. So it actually takes care of all the factors, including stress. Exercise takes care of that as well. And so importantly is this fact that it cannot be compared to gymming. Yes, if gymming involved on the treadmill, aerobic exercises are great for the heart. But yes, the youth today wants to go to gyms to build up muscles, to build up fatigue, look good, which there's nothing wrong with that. But the important aspect to realize is that is not necessarily heart health. Heart health revolves around aerobic exercises, getting the heart rate to a particular level and then going down. And gymming is for physical fitness, of muscle building, for perhaps running 10 kilometers is not necessarily great for the heart. It may be good for stamina, it may be good for weight loss, but may not necessarily be any better for the heart.
Dr. Seth, I just want to take this one step ahead. You were mentioning this also, but about the diet. So any suggestions that you have about maintaining a healthy heart diet so that, we're eating right and keeping our heart healthy through nutrition, through right nutrition?
Those who have high blood pressure and diabetes, of course, they need to be careful about the carbohydrates intake, maintain diabetes under good control, and maintain blood pressure under good control, and take less of saltish food. Apart from that, I would say that we're into diet fads at the moment. Actually, the balanced diet, the most nourishing diet is the balanced diet, without any extremes, where you actually take the evening meal much earlier than later. So you finish your meals by 7, 8 o'clock. And if they're home cooked meals, which are normally cooked in the usual oils, the healthy oils, then there's nothing to exclude from the diet.
The key word is balanced diet there. Mr. Dasgupta, I just want to come to you on another point that we were talking about is, so coming back to the impact of the pandemic. Now, obviously, for people, health insurance is important. Otherwise, also, the pandemic has made it even more important and people are more aware about it now. But I know that your organization, one of the important steps during the pandemic was to keep communicating with customers. What are some of the initiatives that were taken by ICICI Lombard to support customers during the COVID-19 pandemic?
Well, Sumit, like everyone else, we were also affected as individuals, right? So we had to also go into a lockdown right in the beginning. All of us were worried. But thankfully, over the years, we had invested heavily in terms of our digital infrastructure. And that helped us in this period in terms of communication. So we took a lot of effort in the first month, back in April 2020, in terms of digitally communicating with our distribution as also our customers. But very soon thereafter, we realized that there were certain other features that we needed to offer. First was that even before the regulator asked the industry to consider issuing a COVID-specific policy, we launched one. Usually in a pandemic environment, as I explained, it's very difficult to launch a health insurance or any insurance product. It's like giving insurance to someone whose house is burning. So in a pandemic, the situation is something like that. But we felt that it was our responsibility as a company to launch a COVID-specific product. Thereafter, what we did was for our standard products, the normal indemnity hospitalization plans, we said not only will we cover COVID treatment for hospitalization, we also said that the waiting period, which is usually a 30-day waiting period, we said we'll reduce it to 15 days for COVID, because again, it was a crisis for our customers. We said we needed to do that for our customers. Third thing that we did on the product side was to say that when you claim on a COVID incident, because it's a pandemic, we will not take away the benefit that you have for non-claim, right? So we have a equivalent of a no-claim bonus called additional sum insured. So if you don't claim for a year, then next year the sum insured goes up. We said if you have a COVID incident, we will not, reduce the sum insured next year. Thereafter, what we realized was the customers were actually seeking different types of, service, in the sense that, as I said, digital health, healthcare service. So we said that customers were worried about going to hospitals at this point in time for other ailments. So we launched a telehealth service. We had the capability, but we started giving it out for our normal customers, to teleconsulting free. Normally, it's a price product for people who buy that cup, but we gave it out to our customers for free. And then we launched, home-based healthcare. Again, people are afraid of going to hospitals. We said on a cashless basis, we wanted it to be cashless so that we could ensure the quality of treatment and the fact that we were aware of the protocol was as per doctor's protocol. So we launched a cashless home health benefit. So there's been multiple initiatives that we did, very soon after the pandemic hit us.
On that note, it's time for a very short break here on this special World Heart Day show. ICICI Lombard presents Dil Se, partnered by ET Now. Don't go anywhere. We'll be right back. Welcome back to ICICI Lombard presents Dil Se, partnered by ET Now. It's a very special show that we're doing on the occasion of World Heart Day. I'm joined by two speakers, Mr. Bhargav Dasgupta, the MD at ICICI Lombard General Insurance, and Padma Bhushan and Padma Shri awardee, Dr. Ashok Seth. He's the chairman at Fortis Escorts Heart Institute. Dr. Seth, in my opinion, and you're the expert, so I would love to hear from you on this. It's really important that laymen, everyday common people, should be aware of first aid skills. If someone around them is having a heart attack all of a sudden, what's the first thing that we should do? Because by the time help arrives, if there are some simple things that we can do, it can help people. If you could guide us on that.
There are certain cities in the West, like Seattle, where the public has actually been trained to deal with such situations and resuscitate people, with actually multiple lives being saved in the city, because every person or majority of the people know how to resuscitate. We call it cardiopulmonary resuscitation. Now, it's not too difficult to learn, and many centers have started training and teaching public around this. But if someone drops, and this could happen in our own family, it could happen to our friends, it could happen to even in a mall as we're walking, if somebody just collapses, the first thing is to lie him down flat. That's the first thing. Secondly, to understand whether he's breathing or not breathing. Thirdly, at the same time, we say, call for help, which means call an ambulance service, call a police service, but immediately tell someone to call that police. Mm-hmm. The fourth thing we do is make sure his head is pulled back so that his tongue doesn't drop in, and therefore he's breathing. Many people start giving water at that time. That's a bad thing, because the person may be unconscious, and therefore you may actually put water and that may go into the lungs. So the main thing is to keep his airways open. So we call it airways open, which means tilt his head backwards so that his tongue doesn't drop on his airway. The fifth thing is give him a big thump on the chest. When these sudden heart attacks or arrhythmias occur and cause sudden collapse, a single thump to the chest may restore the rhythm back to normal. And so it's a single thump to the chest. And finally, as you seek help, you make sure you're not lying in the middle of the road. You're actually somewhere which is safe for you and the patient. Your second help actually tilts the head back, and you just start compressing the center of the chest right here at a rate of 70 per minute, so that you actually restore as much circulation to the brain as possible. As long as you continue that briskly, you will be able to maintain a person till their health arrives for a period of a few minutes. And those few minutes are the vital ones which you need to maintain the individual.
Absolutely. Thank you so much for that, Dr. Seth. That is really, really key for others.
I just want you to tell you that we used to talk about the mouth-to-mouth respiration also at the same time. It is not essential. What is essential is keeping the airways open and actually pressing the chest. And of course, in these days of COVID, we also want to emphasize that it's pressing the chest, which is far more important than mouth-to-mouth respirations.
Absolutely. Thank you so much for highlighting these really important points. Mr. Dasgupta, just taking this point ahead, World Heart Day is here. It's a really important day in the calendar, especially for India. And Dr. Seth has also spoken about what our scenario here is. Any specific offerings from ICICI Lombard for World Heart Day for people out here?
Sumit, there are multiple things that we are doing. But before I get into what we are doing, I think it's important to explain the philosophy that we are building the health insurance model on. I think global research shows that the entire effort on preventive for normal consumers and disease management for people at risk leads to tremendous benefit for the consumers in terms of lower incidence of hospitalization. I mean, there is research that shows that even for high risk patients, if you manage the preventive and the disease management well, the incident rates drop by 20 to 30%. So our entire effort has been to focus on this entire wellness and the preventive side. So we have an app called IL Take Care app, which focuses on these aspects along with normal insurance services. And this app was launched before COVID, but has really picked up, in the last 18 months. Today we have more than 8.5 lakh downloads of this app. Now here we've kind of focused on some of these, wellness and preventive services. One of the things that we've done specifically as a launch in this period was a calorie counter, because one of the things that we've realized is that among many features of wellness and benefit, diet plays a very important role. And we've had nutritionists and health coaches, etc., which were available, but we have added a calorie counter, so you can scan your items and you can count the calories. The other thing that we've done is, multiple types of products. So what I talked about is service. We also looked at products.
Dr. Seth, I want to talk to you now about the important role of technology, because we know that technology has been a great help during COVID-19 in every sector, every industry, especially telemedicine. Your thoughts on how we can use this to cater to regular needs and medical investigation for cardiovascular diseases? And your opinion, where does India's healthcare system stand considering today's technological advanced world? Where are we headed to? Your thoughts?
India is perhaps, there are more cell phones in India than anywhere else in the world. So that's an important aspect. Our Prime Minister himself is talking about, even as of today, 5G and Wi-Fi for all in this country, which is a great step forwards. And once we see that, we know that a lot of monitoring, a lot of real-time help can be given by remote monitoring. There is also real-time ECG monitoring, but artificial intelligence is coming in hugely as an interface between the patient and the doctor to start immediately advising him, look, this is abnormal. We think you should take an extra tablet by the time your doctor answers you. Or for example, look at the ECG. This is your real-time ECG. We think that this ECG suddenly changed abnormal. We think you should contact a doctor. So artificial intelligence can even do a lot of help to the doctor by removing that lag time between the time real-time monitoring where the patient cannot see the abnormality, but artificial intelligence can see an abnormality and transfer it to the patient and give the patient an advice, and yet transfer it to the doctor to decrease the lag phase.
Fantastic. That's a great leap for innovation, which is definitely going to make a big mark and provide a lot of help to people. Just as we wind up, one last question to Mr. Dasgupta. So what are some of the new product launches from ICICI Lombard that we can expect to see soon, or that have been recently launched by the organization?
You're right in the sense that a heart ailment creates significant, financial impact. And if you look at the prevalence of heart disease, it's really even, between the young age group of, let's say, up to 20 to 49, 1 in 7 people suffer a heart ailment. It's a very high number. And we've launched a critical illness plan, which covers 200 different, critical illnesses, including heart, with a lot of features in terms of lifetime coverage. So even multiple claims, reset benefits, etc. So there are multiple features that we've launched. Lastly, as I said, the entire journey for us is to provide end-to-end healthcare, a continuum of care, starting with preventive to critical care. So on that, we've launched a BFIT product where you can actually get cashless OPD service, all of these features in terms of health coach, wellness guidance, nutrition, etc. Plus, if you unfortunately need to get treated, there is a network of general practitioners, pharmacy chains, diagnostic centers. So in not just hospitalization, even for non-hospitalization, you can get those covers on our app. So these are some of the products and services that we've launched around the World Heart Day.
Dr. Seth, as we wind up this episode, just wanting your closing comments, any message that you want to leave our viewers with on the occasion of World Heart Day?
Firstly, of course, I've always said that prevention of heart disease, protection from heart attacks is in your hands. And in fact, it's not just in your hands, it's actually in your feet. It doesn't require great investments. It just requires sports shoes is what you buy and the roads on which you walk, and you decrease your heart attack. So that's the first thing. In fact, it takes lesser. It's least expensive to decrease heart attacks because you eat healthy, you don't actually eat out, you actually give up smoking and you save money. So everything that you do to prevent heart disease saves you money. And the second aspect I would say is prevention. If you have risk factors, if anyone or I have risk factors, which means smoking or diabetes or hypertension, and I have a strong family history where someone in my family has had a heart attack at a young age or passed away suddenly at a young age, I must start my checkups as early as the age of 20 or 25 and have regular checkups from the doctors so that early signs can be picked up initially and preventive measures put in so that the same fate which happened to, say, our close, near and dear relatives do not happen to us. Prevention goes along those lines. Regular checkup and taking your own personal actions. Those two are important. Stay well, stay healthy, save your heart. That's the most important message.
Absolutely. Thank you so much, Dr. Seth, for that. That was really beautifully put. So thank you so much.
My one message to everyone would be that our most cherished asset is our health. And this is something that has come home very, very starkly to all of us in this period. So do take care of yourself, do take care of your health, do take care of your heart.
Well, that's all the time that we have today on this special show. ICICI Lombard presents DIL SE, partnered by ET Now, where we were talking to Mr. Bhargav Dasgupta, the MD at ICICI Lombard General Insurance, and also to Padma Bhushan and Padma Shri awardee, Dr. Ashok Seth, the chairman of Fortis Escorts Heart Institute, on the special occasion of World Heart Day. Thank you so much for watching. Stay safe and stay healthy.